This is the Growth and Development lecture for infants. I am Professor E. The main objectives for this lecture include recognizing normal growth and development for the infant. We are going to understand how to elicit and assess infant reflexes, and then to be able to apply Erickson's and Piaget's stages of development for the infants. When talking about the infant age group, this is from birth to 12 months of age. So this first year in the child's life, and there's lots and lots and lots of growth happening in this stage of the child's life. So starting at 2 months old, this is where our first growth and development milestones will be happening. As far as physical growth, this baby is growing about 1 inch a month. The head circumference is growing larger at about 1.5 centimeters per month, or just over a ½ inch. And this is when, at 2 months old, the posterior fontanelle is closing. So you shouldn't be able to feel that anymore during your assessment on a 2-month-old baby. As far as the motor skills, this is where the baby should be starting to do some tummy time. So this is what it means when the baby's prone. So this is, the child should be able to hold their head up when they are on their stomach. And when the baby is prone, we want to have them supervised. And also during tummy time, the baby can turn their head side to side. They can move their arms and legs. When you kind of pull them up from a laying to sitting position, they have a little bit of head lag, so those neck muscles still aren't fully developed at this age. And this child can also open their hands for you. As far as language, 2-month-old clearly is not saying any words, but they can start making other sounds other than just crying noises. This means they can start cooing or just making any kind of little baby noises that they do at this young age. With their sensory, they're starting to develop what is going on around them. So if they hear a sound, they'll just visually look, they'll just look with their eyes. They won't be turning their head at this age to figure out where that sound is coming from. They will turn their head when the sound is made at their ear level. So if you're next to the child and speak loudly, they will turn their head to look where that sound is coming from. They can also look at faces. So if you've ever seen children that are really young, they might just seem to be staring at you, but they're just figuring out what a face looks like and recognizing who is who. For socialization of a 2-month-old, they'll start to develop a social smile, just seeing what's going on in life, and this is where a lot of parents will say that their baby seems so happy because of social smiles and sounds other than just crying that the child is making. At 4 months old, we have more physical growth happening. A lot of our reflexes are starting to disappear, and those we will touch on a little bit later in this presentation. But the biggest thing that happens at 4 months old is the baby starts drooling. So they might need to wear a bib all the time or some kind of neck scarf just to collect some of that drool that's happening. With their motor skills, they have almost no head lag when they're pulled up into a sitting position. And to have a good picture of that, you can look at figure 10.5 in the Wong's Nursing Care of Children book. They can balance their head well in a sitting position, so they're still a little top heavy with their head, but they can hold it upright a little bit more. And this is now where they're starting to discover their hands and figuring out what these things that are at the end of their arms are doing. So they'll play with their hands, watch themselves wiggle their fingers. And at 4 months old, this child is rolling from back to side. So we're not quite rolling over from back to stomach or stomach to back. We're about halfway there with the rolling of the motion right now. As far as language development, they can start squealing to show pleasure. They laugh aloud, so they're making you hear baby giggles. They can make consonant sounds, which include the N, K, G, P, and B sounds. They start to have some hand-eye coordination, like I mentioned, them discovering their fingers and hands and the motor skills. They can follow objects from in front of their face to their periphery or to the side of their field of vision. And they can now locate the sound by turning in that direction of where the sound is coming from. With the child's socialization, they can start to anticipate feeding, whether it be if they're being formula fed or breastfed or formula fed. At this age, we're not quite starting them on solid foods. That happens a little bit later, but they know when food is coming. They start to demand attention by fussing, just to be able to get attention of their parents or caregivers. At 6 months old, during the physical growth, this child's birth weight has doubled. So if the baby weighed 8 pounds at birth, we're looking that this kid should be roughly about 16 pounds at 6 months old. They may begin to start teething at 6 months old. The first teeth that appear are the bottom front 2 teeth that start to erupt. They may start to chew and bite, which can sometimes be a problem if mom is still breastfeeding. Mom won't like that too much. As far as their motor skills, at 5 months, this is when the child should be able to roll from their belly to their back. 4 months, we just talked about how they could do a half roll from belly to their side. Now they've just completed that full roll over. And then at 6 months, they can roll back from back to belly. So this child can right themselves from either way that they're placed. They can also grab objects voluntarily. So if you hold a toy in front of them, they can reach out for it. Same thing like their bottle. If they're being formula fed, they can start grabbing for that when feeding time comes. During their language development, they start to begin to imitate sounds. They can also start babbling or saying one-syllable words like mama, dada. In their sensory development, they can localize the sounds that are made above their ear, so they can start tracking where that sound is coming from. They can understand that it's above them. And this is when we kind of start looking at that the child is exploring their world by bringing objects to their mouth. So they will start putting everything in their mouth or bringing at least to their mouth starting at 6 months old. During the socialization and cognition, if the object is dropped, say a toy, they will briefly search for it, but when they can't find it immediately, they will stop looking for the object. At this age, they recognize parents or familiar faces. This can also include grandparents, aunts, uncles, siblings, and they begin to fear strangers. So people who aren't necessarily this child sees daily or frequently, they might begin to fear those individuals. Not only is a 9-month-old still growing in height and weight, but the biggest development of physical growth is the eruption of more teeth. So at about 7 months, this is when the front 2 teeth start to emerge, and then around 9 months, this is when the next 2 upper teeth are starting to break through. So at 9 months old, the baby should have the top 4 front teeth in their mouth. As far as motor skills, this child should be sitting unsupported around 8 months old. They can start to crawl around the 9-month-old mark. And once they start crawling and moving around, they can pull themselves up to a standing position and hold onto furniture to help them stand. They're developing a crude pincer grasp, so this is where they will go use their entire hand to pick up an object. So they'll have their thumb, index, middle, and ring finger to kind of grab some object. And then a little bit later, they'll develop a fine pincer grasp where they just use their thumb and index finger to pick things up. As far as language goes, they can respond to simple verbal commands, and they comprehend no, and they're combining syllables such as dada, mama, and at 6 months old, right, we were talking about that they can say 1-syllable words, and this is now they are combining those syllables into words like mama and dada. As far as their sensory development at 9 months old, they have increasing depth perception, so they're understanding that objects are further away than they appear or closer than they appear. And they develop object permanence at about 10 months old, and this is when they realize that objects leave the visual field and still exist. So if a toy is placed underneath a blanket or maybe behind a pillow or something out of the child's vision, they understand that the object is there and they will start to search for that object. With socialization and cognition, this child is not a fan of dressing or diaper changes. If you talk to any parents with this age of a child, just because this child is starting to become more mobile when they need a diaper change or to get dressed, they have to stay in one spot for an extended period of time while the clothes get put on or the diaper is changed. And they don't really like that. They want to be on the move. The parent becomes increasingly important to them. They will search for their parent for approval. And they start to show fear of going to bed alone or being left alone. And we're going to be talking about this going into Erickson's stages of development and how that incorporates into this age group. They can also wave bye-bye when acknowledging that, following the simple commands, when their parent or guardian, older adult tells the baby to wave bye-bye to other people, the child can wave their hand. We've made it to 12 months. This child is 1 full year old. With their physical growth, their birth weight has tripled. This kid has gained quite a bit of weight in the last 12 months. So if they were 8 pounds at birth, we're expecting this child to weigh around 24 pounds at 1 year old. Their birth length has increased by 50%. So again, using the example, if the child was 20 inches long at birth, they should be about 30 inches long at 12 months old. This is where the child has 6 to 8 teeth, and their anterior fontanelle is almost closed. There's a little bit of an opening still. The fontanelle doesn't close until a little bit later in life, in their toddler ages. And in the toddler presentation, you'll find out exactly when that anterior fontanelle is fully closed and when you should not be able to feel that on your pediatric patient. As far as their motor skills, this child is generally walking, maybe with one hand held. They can be getting around. They might attempt to stand alone. They might not be able to stand by themselves. They can take maybe a couple steps. Generally, the child should be able to take a few steps alone at this age. They can turn pages in a book. It might not be one page at a time, but they can flip pages, multiple pages, especially if they're thin paper pages. They'll turn multiple at a time. If they have a thicker board book, it generally is a little bit easier to turn one page at a time. When we're now starting to attempt to build things, so they can stack 2 blocks or 2 cubes on top of each other to build a small tower. With language, this child has about 3 to 5 words that they can say consistently, and they can recognize objects by name. They can discriminate simple geometric forms. They understand what a circle is compared to a square, compared to a triangle. Now, they're not necessarily able to identify these shapes at this time, but they know that they are different. And they can follow a rapidly moving object. So if a ball is rolling back and forth, they can track that ball in front of them. The socialization, they can search for an object even if it has not been hidden. So if it was just placed somewhere, but they only look where the object was last seen. So if they last saw their favorite toy on the table, that's the only place they're going to look. They might not look at the chair where the toy had been moved to. They're also developing emotions. They can show different emotions such as jealousy, anger, fear, and affection towards others. Next, we're going to discuss reflexes that the infant has, and these first couple of reflexes are ones that will be present at birth. The first one is the grasp reflex. We want to know how to elicit this reflex and know when the reflex disappears for the next few reflexes. So to be able to elicit this one, you just want to place your finger in the infant's hand. And sometimes these babies are born with their hands closed, so sometimes you might have to open up their hand. Once you place your finger on their palm, they should close their fingers around your finger like shown in this photo. And this reflex disappears between 4 and 6 months old. The next reflex is the Moro reflex or the startle reflex, and this is elicited by making a sudden loud noise or an unexpected movement near the baby. The child's arms will extend with the palms up, kind of do like a little stretch and then return back to the body. So as you can see in the photograph here, the baby's palms are up and the arms are extended. This reflex disappears between 4 and 6 months as well. Another reflex, the rooting reflex, is a primitive feeding reflex. This is when you're going to stroke the infant's cheek or side of the mouth. And what this is going to do is get them to turn their head towards that motion in attempt to suck. So this is definitely a reflex that we want to look at if the mom is breastfeeding. This is generally a good way to get the child interested in feeding. And this reflex disappears at about 4 months old. With the next reflex, the sucking reflex, we've just mentioned that the rooting reflex helps deal with feeding, and the sucking reflex is just as involved with feeding as well. So to elicit this one, you're going to place your finger, usually with the pad side up, into the baby's mouth, feeling the hard and soft palate. With that, the infant will start to suck on your finger. Like this photo shows, the adult has their pinky finger in the child's mouth. When you are doing this in the clinical setting, please wear a glove before sticking your finger into the child's mouth. This reflex disappears at about 4 months, and it becomes just a voluntary movement after that. So when we are older than 4 months old, you can place an object into the child's mouth, and the child doesn't always necessarily start to suck on that object. So it just becomes a voluntary motion after 4 months old. The Babinski reflex is when you stroke the infant's foot on the lateral side, starting from the heel, and go upwards in a medial motion towards the big toe, and the toes will fan out. So you may remember from the med-surg classes that in an adult, a Babinski reflex is a bad sign, but in a child, this is a perfectly normal finding. This reflex disappears at about 12 months old or 1 year. So this is why it is abnormal in people older than 1 year old, especially in adults. But brand new newborns and in this infant stage, the toes fanning out when you stroke the bottom of the foot is a perfectly normal reflex. These next couple reflexes are reflexes that develop as the child is growing. So this is a reflex the child is not born with. And the first one is the parachute reflex. This is when you can have the infant suspended horizontally, and you kind of tip them downwards. Their hands should extend, their hands and arms should extend forward as if to protect themselves against falling. As you can see in this picture, the baby is putting their hands onto the table to protect themselves. The other important things to note with these reflexes is when the reflex appears during the infant developmental stages, and then when this reflex disappears. So the parachute reflex appears around 6 to 8 months old, and it never disappears. This reflex, again, if you took an adult and you did the same thing, if pushed them forward, you would notice that your natural reaction is to put your arms out and attempt to protect yourself. The next reflex to talk about is the Landau reflex, or looks like baby Superman. This is when the baby is in a prone position on the floor or on a flat surface. The head is raised, the arms raise up from the ground, and the legs raise up above the ground as well. So it looks like they're flying, if you will, like this baby is demonstrating in this photo. This reflex appears at about 6 to 8 months of age, and then it disappears between 12 and 24 months old. During Erickson's stages of development, the infant is in the phase 1 stage. So this is the trust versus mistrust. And the infant will build trust with the caregiver for feeding, comfort, and tactile stimulation. So that the caregiver is to provide the basic needs for the child. This is when the infants begin to trust that they will be fed, that they will be comforted when they are crying, when they're hungry, when they're provided with food and warmth. They understand that they will be cared for. When these needs are met, the infant knows that they can trust their surroundings and they can trust the caregiver, the parent, the adult in their life. However, when these needs are not met, the infant will develop mistrust. So if the infant is frustrated, if there is too much of delayed gratification, that's when mistrust can happen. So, or any kind of prolonged delay whether they've been crying for a long time and then the caregiver comes to pick them up to comfort them, or they're hungry, they wanted to eat maybe an hour ago, but their feeding schedule was delayed. This is when mistrust of their environment starts to begin. So the infants need to have reassurance that all of their basic needs, so even think about Maslow's hierarchy too, the basic food, water, shelter, that bottom level of the hierarchy is met. During Piaget's cognitive development, the infant is in the sensory motor phase. Now, this is a 6-stage phase, and with the infant, they're going to go through the first 4 stages of the sensory motor development. So the first stage is the use of reflexes, and this is from about birth to 1 month old, so just the very beginning of this infant's life. And this is where the physiologic reflexes, those, the suck reflex, root, grasp, crying, these are where the infant is beginning to learn how to use those. And the repetitive nature of the reflexes is the beginning of the associations between an act and a sequential response, such as when the infant cries because they're hungry, a nipple, whether it be from the mother's breast or the bottle, is put in their mouth. They can start sucking, get the food that they need, and then fall asleep. They start to assimilate this experience while perceiving auditory, tactile, visual cues, and then this experience of perceiving these patterns provides foundation for subsequent stages of development. The second stage is the primary circular reactions, and this marks the beginning of the replacement of reflexive behaviors with voluntary acts. So like we've mentioned before, the suck reflex stops being reflexive at 4 months old. This is now becoming just a voluntary act, and this stage takes place between 1 and 4 months old. This is where infants start to incorporate and adapt their reactions to the environment and recognize the stimulus that produced a response. Previously, they would cry until the nipple was brought to their mouth. Now they associate the nipple with the parent's voice. They accommodate this new piece of information by adapt and ceasing to cry when they hear the voice, even before receiving the nipple. So think of the Pavlov's dogs, where the dogs, once they heard the bell, they would start salivating. What takes place during this time is that the realization of causality and recognition of an orderly sequence of events. And this is where the infant takes in the environment with all the senses and with whatever motor ability is present. The third stage in the sensory motor phase is the secondary circular reactions. And this generally takes place between 4 and 8 months old. And in this stage, this is where reactions are repeated and prolonged for the response that results. So grasping and holding now becomes shaking, banging, and pulling. So the infants like to shake objects and hear noises, not solely just for the pleasure of shaking. The quality and quantity of an act become evident. More or less shaking produces different responses. Casualty time and deliberate intention and separateness from the environment begin to develop. And the fourth stage of this phase is the coordination of secondary schemas and their application to new situations. So this is where the infants are using previous behavioral achievements primarily as the foundation for adding new intellectual skills to their expanding repertoire. This stage is largely transitional. Increasing the motor skills allows for greater exploration of the environment. So we were talking about that the child is crawling a lot more. They don't like to be put down when they are getting dressed or getting their diaper changed, and this stage is happening between 9 and 12 months old. They begin to discover that hiding an object does not mean that it's gone, but just removing the obstacle will reveal the object. This also marks the beginning of intellectual reasoning. The infant can also experience an event by just observing it, and they begin to associate symbols with events, such as bye-bye, meaning mommy's going to work, or they're leaving. But the classification is just their own. During this stage, they learn from the object itself. This is in contrast to the second stage, with the infants learn from the type of interaction between objects or individuals. Intentionality is further developed in that infants now actively attempt to remove a barrier to the desired or sometimes undesired action. If something is in their way, they will attempt to climb over it or push it away, whereas previously they would have given up any attempt to achieve that goal. So if they couldn't find their toy underneath the blanket, they would just give up, as opposed to now being able to remove the blanket and search for their toy. This presentation was based around Chapter 10 from Wong's Nursing Care of Infants and Children book.